Welcome back to Superhuman Radio. You know, one of the supplements that I will not live without is Resveratrol. And quite frankly, I am fortunate enough, and those of you who listen to the show are fortunate enough to know about the single best Resveratrol product in the world, made by RevGenetics, Nitro 250, not just because of the dose of Resveratrol, but also the delivery mechanism that they have provided to make sure that you're getting the highest amount bioavailably delivered. And so whenever I see studies about Resveratrol, it really pisses me off because the mainstream media loves to say red wine. We actually had the scientists on the show who did the research that showed Resveratrol activated some of the same genetic triggers and functions physiologically as exercise. And the Daily Mail in the UK did an article that said, you know, skip the gym and drink some wine. And I had the author of the study on, and he was just as pissed off about that as me, because that's not what the study said. The study said if you supplement with Resveratrol, it didn't say if you drink red wine. But the media loves to take Resveratrol and make people think that if they just have a glass of wine here and there, that they're accomplishing the benefits of Resveratrol. That is not true. That is a blatant misrepresentation. My next guest is Dr. Hector Valenzuela. He's been on the show before. How you doing, Dr. Valenzuela?
Hi, how are you, Carl?
Now,
Great to be here.
You've dedicated a lot of time to researching Resveratrol and curcumin and things like that. Does that piss you off as much as it pisses me off whenever a good study comes out on Resveratrol and they just discount it and say, yeah, just have a glass of red wine?
Oh, absolutely. I mean, the comparison is ludicrous for the following reason. I mean, you can find Resveratrol in a lot of other things, not just red wine and the skin of grapes, but you can also find it in peanuts. You can find it in a lot of different fruits.
Not weed, right? You can find it in knotweed. You can find it in so many things. Right. Yeah.
But what you can find is that the amounts of Resveratrol are extremely small. So in order to be able to say, oh, I can just drink a glass of wine and that will be it, when you're comparing it directly to the Resveratrol at high concentrations is crazy. There's a lot of side effects also of drinking red wine to that degree.
Let's remember something. You know, I haven't had a drink in several months, quite frankly, because I decided that I don't enjoy the buzz more than the neurological damage that alcohol does. I made that decision when I got back from my trip to Alaska, and I think I've had one glass of wine in the past 4 months, and that was for celebratory purposes. I didn't want to be left out. But the reality is that the neurotoxic effects of alcohol far outweigh any benefits that you will get from the Resveratrol in a glass of wine. So don't lie to yourself and think you're doing something good when you're drinking wine, because if you're doing something good by drinking wine, then by all means, give it to your grandchildren and your nieces and nephews, and give it to your dog and your parakeet, because everybody deserves the benefits of it. And that's a ludicrous idea because you know that it's harmful for them. Well, guess what? It's harmful for you too. Now, with that being said, you told me something off the air that needs to be said. Most of the research that shows the beneficial effects, both acute and long-term, on Resveratrol, they all do a half a gram, 500 milligrams of Resveratrol. How many glasses of wine, Dr. Valenzuela, would I have to drink on a daily basis to get 500 milligrams of Resveratrol a day?
You would have to drink 500 bottles of red wine.
Bottles. Not glasses.
Yes, bottles.
Yeah. And then you'll die of liver toxicity on that one right there. So.
For sure. If you're going to be doing this on a daily basis, I don't think you will survive one day.
Yeah. There you go. And so now let's talk about the research. Now let's shift over. Now, when we talk about this research, if you interpret this as, oh, I just need to drink more red wine, then maybe you don't belong on the planet. I don't think life is for everybody. I'm not being facetious. I think some of us, we just don't have the common sense to put one foot in front of the other, so chances are we're not going to survive very long. So if you're going to interpret this research as, oh, I just need to up my red wine, you missed the message entirely. So what is the new research on the linkage between Resveratrol and the reduction in progression of Alzheimer's disease? Please talk about that.
We started doing studies on humans, and around 2012, I believe it is, we started a study with using Alzheimer's patients. So here were people that were very prone to getting Alzheimer's, high-risk patients, or they were already having the initial syndromes that was getting started. So what they did is they took these patients and they started giving them initially 500 milligrams of resveratrol, and then they upped it up to 1 gram. And they found that it was not only safe, but what happened was that those patients stopped progressing in their disease. And some of them were slowed down in the disease. So we found now that, the study was concluded about a year ago, and it took a while to get all the data together and publish it. But it just came out that study that was initiated in 2012 has shown that a lot of the biomarkers that are shown when somebody's progressing through the disease of Alzheimer's have reached a complete stop or have been stopped.
Okay, so now let's talk about pathways for a second, and then let's kind of examine this. One of the things that the study showed that it cleared the plaque that is associated with the development of Alzheimer's disease, and it could be corollary, it could be causative, but clearly it cleared the A beta, the beta amyloid plaque from the brain faster, which was one of the benefits. But was that a direct result of resveratrol's well understood glucose managing effects? Or was there another pathway that was causing the clearing of the A beta plaque?
Okay, that's a great question. So let me just start by saying this about resveratrol. Resveratrol is known to affect various pathways to some degree or another. Now, Alzheimer's is characterized by actually two things. Not only does it accumulate those plaques, which referred to sometimes as senile plaques, but it also creates this neurofibrillary tangle. So the neuron, the nerve cell, gets tangled up because it accumulates another type of protein in there. So there's two major features of Alzheimer's that are well known, and resveratrol to some degree affects both pathways.
Wow!
But in this particular study, it was mostly the plaque that was targeted that they were really looking at. But this is not to say that the researchers that did this are not going to pursue that. Now they're actually going to pursue the other biomarkers of Alzheimer's and seeing what effects were done on them through the treatment of resveratrol.
Okay, so resveratrol has been compared to the gold standard for blood sugar management, which is metformin. Milligram for milligram, resveratrol outperforms the protection against hypo and hyperglycemic episodes better than metformin, and this has been proven in several reproduced studies. So this isn't a fluke. With that being said, we also know the development of these plaques quite often is the result of misfolded proteins. Proteins are messengers between cells, and the endoplasmic reticulum in each cell is designed to fold proteins and assemble the amino acids in a certain way that has a syntax, that has a meaning when it gets transferred to the other cell. And we think that these plaques are the result of the syntax being incorrect or the protein being sent at the inappropriate time, and so the receiver doesn't need it, and it floats around and it finds a home and it sticks somewhere and it develops these plaques. We know that the endoplasmic reticulum increases the rate of misfolded proteins in two instances very well: fragmented sleep and severe fluctuations in blood sugar, especially hypoglycemia. We know that fragmented sleep can be promoted from hypoglycemia. Can we extrapolate these results by saying that because resveratrol is so good at managing blood sugar, it stabilizes and eliminates to a great degree the highs and lows, the hypoglycemic and hyperglycemic episodes that over time start to get the endoplasmic reticulum to stop spitting out misfolded proteins that creates the aggregate that builds up to plaque? I mean, I'm just a guy doing a radio show, but that seems very obvious to me.
It is. To anybody that's just getting started in this field, that is one of the first things that they start to notice is the vast amount of pathways that are being affected by resveratrol. And I believe you are correct. You pretty much described it perfectly. In my opinion, I agree with what you just said, that it is something that happens as it's kind of like a secondary step. If you're preventing diabetes, you're going to be preventing some other diseases that are age-related, right? And that kind of like brings me to a point that I would like to make. There's this idea that's been floating around now for several decades, that there's medicine in general approaches treating the disease as a single disease, right? So
Right.
you go to the doctor because you have a disease and they're going to treat that disease, right? And that's fine. That's great. And refer to that usually as the medical model, right?
Right.
But what people need to start to understand, and doctors need to start to understand, and I think in all honesty and fairness to them, they are picking up on that there's a whole bunch of different pathways that can be treated with one compound. Okay, so like you mentioned, Metformin, it's used to treat diabetes, but now they're starting to think, well, maybe we can use it to treat some other diseases.
Right.
Right. And Resveratrol is the same thing. You can go up and look at clinical trials, and you're going to see that not only is Resveratrol used to treat Alzheimer's, but it's used to treat different types of cancer, so on and so forth. So what people are starting to realize is that some of these diseases overlap in their signaling pathways. So if you affect or influence one pathway, you can actually have a positive outcome on several diseases. And it's kind of like a trickle effect. So what you're saying right now, you're trying to affect the pathway is going to affect diabetes, and it has a trickle-down effect that it's going to affect also Alzheimer's. It can also affect cardiovascular diseases. It can also affect cancers. So yes, life is a web of signals, and you start messing with one or two of those signals, especially if they're in the level of importance upstream, as we call it in science. It's going to have a downstream effect, and it's going to affect a lot of different things.
And this is actually an emerging type of science. This is called systems biology, where instead of the old adage, we've talked about this on the show before. If you put five people at different points at an elephant, and one feels the tusk, and one feels the trunk, and one feels the leg, and one feels the back, and you ask them what they feel, they all have a different perspective of what they feel, but because they don't see the whole elephant. And this is actually an emerging area of research now called systems biology, where instead of saying, okay, let's look at this one symptom, let's treat this one symptom, instead they're saying this symptom is a response to a complex event that's affecting several systems in the body. So let's go all the way back to the domino one that is falling that triggers all these other, and let's address that. And quite frankly, that forces clinicians. Six different symptoms at the same time, as you so eloquently point out. And this makes sense when you think about the rate of cancer, Alzheimer's disease, kidney failure, and I can go on that diabetics suffer from, heart disease. So when you start to say what causes diabetes and you start treating the diabetes, all these other things seem to go away.
That's correct.
I love it. I love it. Okay. We're talking with Dr. Hector Valenzuela. I want you to stay with this because this is going to get really interesting, I promise you. I love Resveratrol. I take Nitro 250 from RevGenetics. I take it twice a day. It is the single best Resveratrol product in the world, and that's why I fought hard to get Anthony Loera to come aboard as a sponsor of this show, because I love the product, and you should be taking it too. If you want to learn more about it, go to my website, superhumanradio.com. and click the metacurcumin beta ad to get to their website, and then also search for the Resveratrol product. Stay tuned. We'll be right back.
If you take curcumin, you need to pay attention. The best curcumin on earth is metacurcumin. Metacurcumin is up to 277 times more bioavailable and absorbs over 6 times faster than standard curcumin supplements. Metacurcumin even outperforms those supposedly high-performance curcumin products. There's only one metacurcumin by RevGenetics. You could save 20% off metacurcumin by clicking the banner ad at superhumanradio.com and use superhuman curcumin at checkout. If you want to help stop inflammation in its tracks, you need metacurcumin by RevGenetics today.
Spit that out right now. This is the Superhuman Channel.
My guest this hour is Dr. Hector Valenzuela. Dr. Valenzuela, you teach at Whittier College, right?
That's correct.
Yeah, but aren't you also a visiting professor at UCLA or something like that?
Yes, I have been for the last 2 years, or 3 years now, but my collaboration with them is a little bit on and off at this point.
Okay.
At this point.
I just wanted to establish some of your background real quick for the audience. So, I take Nitro 250 twice a day. Is that adequate because of the advanced delivery that that I guess they call it tween that they make? And I'm pimping this product because if you're taking a Resveratrol product, this is the one to take. If you're not taking, this is the one to take. Do you think that's enough, or should I be upping it to a gram a day?
I think at this point that would be enough. A lot of the studies that have been done on Resveratrol, they want to see how high they can go and still be safe. So 1 gram was as high as they went, and that was still considered safe. And I think at that point, there really were very little side effects. I think very few people had any type of trouble taking 1 gram, but it is a fairly large amount, and so they just basically capped it at that.
Okay, so let's talk about one of the other effects of Resveratrol, one of the earlier effects that made it so popular within the anti-aging community, and that is its increase in sirtuin production. And sirtuin production has been implicated in the ultra-low calorie diets that seem to extend life. So it's thought that when sirtuins increase, that there's a life extension benefit from them. But the other thing that people don't pick up on that I'm going to ask you about now is when you fast for 16 hours or more, the body increases sirtuin production, but it also increases a phenomenon called autophagy, which is since the body is not playing host to digesting food, it can clean house. And autophagy on a cellular level is designed to rid the body of metabolic waste and debris and kind of cleanse the cell so the body functions better. Is there any research out there that implicates Resveratrol since it increases sirtuin production? Does it also increase autophagy?
Yes, there is some evidence that is indeed the case. So when many years, decades ago, they started looking into cutting calories, and they started these experiments in rodents, and they wanted to find out if they can delay the onset of development. But instead, what they found out that was very important was that it actually extended the lifespan of these rodents, and this really got scientists very excited. It was, they were not expecting that result. And then they started looking into all kinds of animals, and in every single case, the same effect happened. You cut the calories, the animals live longer. So naturally, we start trying on humans, and so a lot of humans that try to do this caloric restriction, which basically entails reducing your calories by 1/3, and it's similar to what you were just saying right now, that, just going on a diet, not eating anything for the day. But instead here is cutting the calories by 1/3. And they noticed that there was a lot of proteins that were activated, and currently we found out that one of those proteins is actually sirtuins. So they started looking into the sirtuins and seeing the effects that it had on a lot of different proteins. And in addition, now they found out that also mTOR may be affected. Now, nobody wants to cut calories by 1/3. I know I don't. So we started looking at other means of triggering those same signaling pathways without cutting the calories. And one of the products that we found was Resveratrol. Resveratrol was found to activate sirtuins to a very, very high degree. And sirtuins have this effect where they can modify a lot of different proteins indirectly, and those proteins in turn affect a lot of what we now see as age-related diseases. So when we think of living longer, what we really are doing is we're avoiding diseases, increasing our health span, our healthness, and then by that means living longer. Do you see what I'm saying? So
do you think that part of the effects they saw on the progression of Alzheimer's, reducing the progression of Alzheimer's disease, had to do with the fact that autophagy was improved and this metabolic waste, this plaque, was being scavenged and eliminated from the body?
Exactly. So mTOR is a protein that actually activates autophagy. And what it does is, as you explained, is that it's a kind of like a cleanup system within the cells. So we have a set of proteins, and there's three major mechanisms of how it works. But we have these proteins that, like all proteins, they get old after they've been used for a prolonged period of time, and we need to get rid of them. But if they hang around long enough, they start to malfunction, and that causes the entire cell to start to malfunction. So when we have this caloric restriction or this activation of autophagy, basically, we don't have, the cell doesn't have any proteins to spare, so it starts to devour and recycle and break down the old proteins, and only the new proteins are around because there's only so much to go around. So in essence, what happens is the cell itself becomes much more efficient at working because there's limited resources. And that's where this autophagy comes into play.
I want to take our next commercial break. When we come back, I want to change the topic just slightly. Recently, it was announced that a new human anti-aging study is underway using metformin. And I want to talk about the differences in how perhaps resveratrol would have been a better choice than metformin. We're talking right now with Dr. Hector Valenzuela. We're talking about resveratrol. It's an amazing supplement that anybody over 40 should be taking for sure. I take it, and I will continue to take it to the end of my days. And we just happen to have a sponsor that's the best resveratrol product in the world at RevGenetics, and you can learn more about them. If you go to superhumanradio.com, you'll see a RevGenetics metacurcumin banner ad. If you click that, it'll get you to their website. Buy both of them. They're both great supplements for aging. Stay tuned. We'll be right back.
Take curcumin, you need to pay attention. The best curcumin on earth is metacurcumin. Metacurcumin is up to 277 times more bioavailable and absorbs over 6 times faster than standard curcumin supplements. Metacurcumin even outperforms those supposedly high-performance curcumin products. There's only one metacurcumin by RevGenetics. You could save 20% off metacurcumin by clicking the banner ad at superhumanradio.com and use superhuman curcumin at checkout. If you want to help stop inflammation in its tracks, you need metacurcumin by RevGenetics today.
You're listening to the Superhuman Channel. We're ripped and we're ready.
Welcome back to Superhuman Radio. We're talking to Dr. Hector Valenzuela. We're talking about resveratrol. Well, we're going to continue to talk about resveratrol, but from a different angle. Recently, it was announced that a human study is undergoing right now that's looking at the drug, the diabetes drug metformin, as an anti-aging therapy. Now, early in the show, we talked about how in scientific studies, metformin has been compared to resveratrol, and resveratrol outperforms metformin time and time again, milligram for milligram, in its ability to regulate healthy blood sugar levels, keeping blood sugar from getting too high or too low. Now, when I heard this study, I immediately called my doctor, and I said, I want metformin. And he was willing to prescribe it. But then a good friend of mine, Dr. William Seeds, who's an orthopedic surgeon, who runs a amazing Olympic training facility up in Cleveland, Ohio, said, you better look a little deeper before you jump. And I said, why, Bill? He said, look at what metformin does to mTOR. So when I started digging around, I found out that metformin actually suppresses mTOR. Now, to those of us who train hard, we don't want to suppress mTOR. We want our muscles to grow. So my question to you is, what does resveratrol do to mTOR?
Okay, so there's a couple of things that I want to point out first between the comparisons between metformin and resveratrol. The key one is what you just indicated right now, that you had to go to your doctor to get metformin. And metformin is a drug, and resveratrol is a natural occurring compound. So it's like eating a fruit.
Big difference, right? Nature is perfect. The pharmaceutical industry is not.
Exactly. So that's the first point. point that I want to make. The second thing that I want to say about metformin, and I believe that the study that you're referring to is called TAME, which stands for Targeting Aging with Metformin. And the purpose of that study is so that, as you said, there's been actually it just recently occurred over the summer,
right,
where a lot of researchers got together with the USDA, and they wanted to push for a lot of compounds, and they want to treat these compounds as, and promote them as anti-aging pills, in essence. So they want to see if there's a legitimate classification that can be created where we would have actually compounds that are considered anti-aging. However, a lot of these compounds are compounds that are already in existence, and one example is metformin. Now, as you mentioned, metformin does have some side effects that we don't encounter with resveratrol. Again, nature being way better than the pharmaceutical companies. So, for example, metformin can give you diarrhea, bloating, gas, indigestion, and constipation. So these may not be very, very critical, but it does have some other ones that are much more important. And one of them would be, for example, if patients start to suffer from chest pains. And the other ones that are not well studied yet in humans, in the clinical trials, are the fact that metformin can affect your mTOR. And mTOR is not something that we want to mess around very lightly.
Let's just do a primer. mTOR stands for the mammalian target of rapamycin. It is upregulated during the protein synthetic response of exercise and protein consumption. It's triggered by leucine, and what happens? mTOR is what builds muscle. And without mTOR, you undergo muscle wasting. And we already know that muscle wasting is not a good thing. Sarcopenia is a leading cause of death in the elderly. They lose muscle, they lose mobility, but more importantly, muscle is now understood as almost like an endocrine functioning tissue. It produces hormones, and it also, by the way, the more muscle you have, the better blood sugar management you have. So while you're losing muscle, your ability to move, your ability to stay strong, your ability to manage blood sugar all dissipate, and metformin does that. But clearly resveratrol does not.
Yes, and there's one other thing that I would like to point out. You mentioned rapamycin, another compound, synthetic compound that is commercially available, but it is a compound that also can affect mTOR. And initial studies showed that rapamycin can extend lifespan. But here's the caveat to this whole study, is that rapamycin can also inhibit your immune system.
Yes.
And this is one reason why you can't just go around taking rapamycin.
Well, guess what they get? Guess who gets rapamycin? When you have an organ transplant, it's called an anti-rejection drug. They give you rapamycin so your body doesn't go, wait a minute, that's not my heart, kill it. So it completely derails your immune system, which means that you not only attack this foreign tissue any longer, but you don't attack anything. You start getting sick all the time because your immune system is literally shut off.
Exactly. So if you want to have all these organ rejections, you start taking rapamycin. Now, obviously, you prefer to suppress your immune system at this point, because otherwise the other option is death immediately, right?
Right.
Immediate death because of the organ rejection. In those cases, you can see why it would be beneficial. But for a normal person who's healthy, who does not have those issues and wants to keep an intact immune response against any pathogen, taking those drugs, metformin and rapamycin, may not be very good for you.
Not a good idea.
There's definitely going to be a catch. So you have to measure the benefits to the harm that can be caused by these drugs.
And if you're a healthy person and you're training in the gym and you're wanting to maintain or maybe even build muscle, metformin is not the drug to take, because it is going to stop any gains and perhaps even cause the development of sarcopenia over time. So resveratrol is the only choice. If you want to leverage the phenomenon, and let's be honest, why metformin works as an anti-aging drug. It's not because it can extend life overall. It extends the life of the average person who is consuming way too much starches and sugars, because we did the show in 2006 that Glucose signaling is what triggers cellular senescence. If you want your cells to get old faster, then the easiest thing to do is to eat lots of sugar, because when your blood sugar goes up and your body has to produce insulin at higher levels, the cells age faster. So the premise that metformin is going to prolong life is it's going to prolong the life of the average American whose blood sugar is flying high all the time. So you don't need metformin if you are a healthy person who's training hard and wants to maintain or grow muscle, and you're already managing your blood sugar through diet and exercise. You need resveratrol. Would am I going out on a limb here, Dr. Valenzuela, by saying that?
No, you're not. I would agree with you. You know, that there's a clear difference between both compounds, and in every way possible that I can think of, resveratrol is a much better product than metformin if you want to increase your healthy years, right? But without having these bad side effects that for a normal person, a healthy person, it would be extremely detrimental.
Does resveratrol produce any anti-inflammatory effects? I know that I take resveratrol with metocurcumin. I take the Nitro 250 with metocurcumin because I also want the anti-inflammatory effects of metocurcumin and also, quite frankly, the cancer protective effects as well. But is resveratrol itself anti-inflammatory in nature?
Yes, it is. So resveratrol has been shown to lower inflammatory responses in all kinds of tissues. And actually in that study that we were talking about earlier on how resveratrol can affect Alzheimer's disease, one of the side effects that they believe is that the brain, when it's suffering from Alzheimer's, swells up. And they believe that one of the positive things about resveratrol is that they found, that I find very amazing, is the fact that resveratrol can penetrate the blood-brain barrier, okay, and it can influence the brain in such a way that it can actually reduce the inflammatory response. And they believe that maybe that is one of the mechanisms of how resveratrol is aiding the onset of the delay of Alzheimer's disease.
Okay. I want to take our last commercial break, and when we come back, I want to talk about resveratrol supplementation. Doses, timing, and that sort of stuff. If you can just kind of expand on that, that would be great. We're talking with Dr. Hector Valenzuela. We're talking about resveratrol. If you are getting up in age, whatever that means to you, if you're starting to see the signs of aging that you don't like, you really do need to add resveratrol to your supplement regimen and not red wine. I think we dispelled that myth at the beginning of the show. Stay tuned. We'll be right back.
You need to pay attention. The best curcumin on earth is metacurcumin. Metacurcumin is up to 277 times more bioavailable and absorbs over 6 times faster than standard curcumin supplements. Metacurcumin even outperforms those supposedly high-performance curcumin products. There's only one metacurcumin by RevGenetics. You could save 20% off metacurcumin by clicking the banner ad at superhumanradio.com and use superhuman curcumin at checkout. If you want to help stop inflammation in its tracks, you need metacurcumin by RevGenetics today.
This is the Superhuman Channel, where brawn and brains finally meet.
That's just the way it is.
Welcome back. We're talking with Dr. Hector Valenzuela. We're talking about resveratrol. Every time I take my resveratrol, I feel good. I feel like I'm doing something good, like depositing money in a bank for my future, because I feel that resveratrol is one of the few things that, as the science unfolds, we understand better and better how good it really is for us. So I've been promoting the resveratrol that belongs to a sponsor of our show. And the truth of the matter is that I worked for years to get Anthony Loera to advertise on this show because I believed in his product so much. The Nitro 250 has a delivery system that improves the bioavailability of the resveratrol in it, Dr. Valenzuela. So there's a greater plasma spike initially than just taking 250 milligrams of micronized resveratrol any other way. But that spike kind of dissipates pretty around the same time that most of resveratrol spikes dissipate, at about 120 minutes. And then it goes out, and it just is a trickling into the blood out to the 240. So I'm taking my resveratrol twice a day. Is that a mistake? Is it the metabolites of the resveratrol that where the magic lies, or is it actually the frank resveratrol itself hitting the bloodstream?
That's a good question. So let me just start by answering this. So resveratrol was always believed to be directly binding to the sirtuins, sirtuin 1 in particular, and having its health benefits that way. Now, that became a little bit controversial with some other studies that said, no, resveratrol does not directly bind to the resveratrol and cause these health benefits. In my opinion, it really doesn't matter for the following reason. The fact is still there that when you add resveratrol, you activate the sirtuins. Okay, so it's been very well studied, but it continues to be somewhat controversial that what exactly is resveratrol doing that is activating the sirtuins. So a lot of people believe that actually the resveratrol gets processed once it gets taken into the body, once it gets digested, and it's, as you mentioned, those metabolites, those other forms of resveratrol that are actually having its effects. I think the bottom line is this. You take resveratrol, you activate those proteins, you get the health benefits. Now the question is, well, how exactly is this happening? Because when resveratrol first gets taken in, it, as you just correctly mentioned, it gets broken down. It gets, but those other components that are the products of resveratrol, once it gets broken down, may be what is carrying out these health benefits. And the science of that is still a little murky. We don't know for sure. We just know that once it does get processed, you nevertheless get the activation of sirtuins, and these other metabolites may linger in the cells or in the bloodstream far longer than resveratrol. But as you correctly pointed, resveratrol does get broken down. So now the idea of this product is that it gets digested far, far slower. So smaller amounts of resveratrol may be activating other components that are giving you this health benefit. So that the effect is extended for much longer time.
Okay.
So
so I take my first dose of resveratrol post workout, which is generally around 10:30, 11 o'clock in the afternoon, and then I take my second dose, 250 milligrams of high delivery resveratrol with my last meal, which is always 6 o'clock at night. Should I just take it all in the morning, or should I? Is it okay? Am I doing something wise by spreading it out like that?
I think you're doing something wise by spreading it out. Because if the effects are going to be for a few hours, then, having that effect twice a day is far much better than having it just one time during the day. Even if that one time of the day may be fairly high, it's still better to kind of like spread it out.
Well, my other thinking is, as we age, I almost am starting to believe that there may be an evolutionary predisposition to become more insulin resistant as we age, as a protective mechanism for an aging being of a species that it would be implied that would have a harder time finding food and fending for itself as it becomes weaker and more feeble. The body says, we're going to need to invest more adipose tissue for those times where we have we don't have a lot of food. And so my thinking is, if I take that second dose at 6 o'clock at night, that its effects will improve blood sugar management at night when I sleep. Do you think there's any evidence to that?
I can't really remember at this point if there's any research that has been done to answer your question, but I think you are right in that sense that you're believing that as we age, our bodies are definitely changing. That's well known, but that the changes can be modulated to some degree by resveratrol. That I have no doubt about. So I kind of support what you're doing, taking it late at night, and I agree with your belief that we are, that aging is a process that has been passed on through evolution, and it's been conserved because there hasn't been any real selective pressure to do the contrary, really.
Right. What about with food? Should people be taking their resveratrol with food or on empty stomach, or does it matter?
I don't think it matters too much, but except for one little fact that when you do take food, your stomach is kind of primes itself to absorb the nutrients. So I think that taking it with a meal or after a meal would be the best time, because at that point your stomach is absorbing more.
And the pH of the stomach goes up, meaning it's more alkaline than acidic. So you would imagine that there would be more available, not broken down by the caustic stomach acids too.
Yes, that's correct.
What do you hope both lay people and clinicians take away from this most recent research on resveratrol's effect on perhaps the reduction of progression of Alzheimer's disease?
I think one of the things that I would point out is that Alzheimer's is a very slow and progressive age-related pathology, and that when you take resveratrol, you have to keep in mind that what you really are trying to do is slow down the progression of this disease. I mean, there is no evidence really that says that you can completely cure it. You can't cure it, Alzheimer's, right now, but it's the fact that you want to slow it down almost to a complete stop, and in some cases that's what the paper indicated is that in the study is that for at least a 1-year period the disease did not progress, and that already in itself is an amazing finding. But I don't think it's the cure necessarily, but it is the fact that you're slowing down the disease, and I think that's the take-home message. You're not going to hurt yourself by taking resveratrol, and you've just got everything to gain from taking it.
Well, and I have to say, and you may not be aware of his research, but Dr. Dale Bredesen, who is also a scientist from UCLA, successfully reversed Alzheimer's disease in 26 individuals. Last year he was on the show, and they're embarking on a larger trial now. But it was not with a pill. It was not with a pharmaceutical therapy. It was with the lifestyle changes that included promoting autophagy by having your last meal be before 3 hours to sleep, before you go to bed for 3 hours later, getting to bed by 10 p.m. the latest, putting all these people on hormone replacement therapy and getting their hormones in a more youthful range, exercise. In fact, there was one guy in the study that was a business owner. He had multi-offices around the United States, and he was only in his late 50s. And he was being forced to retire because the memory loss aspect of Alzheimer's disease had robbed him of his ability to run his businesses. And after the 1-year trial with Dr. Dale Bredesen, he actually went back to work and opened up 3 new offices. So when I hate it, not you, I hate it when I hear people from the pharmaceutical side of the fence say there is no known cure for Alzheimer's disease. All we can hope to do is slow it down. That's not true. There is some amazingly groundbreaking research coming out of California that you can reverse it. The problem is it's not in a pill. It's in a lifestyle. And getting people to change their lifestyle, I think we'll have an easier time living on Mars next year than getting people, because people do not want to give up the things that they love, even if they know their disease is going to progress.
That's correct. And thank you for clarifying that, because, I am trying to specify that there is no cure in the sense of a pill, a magic pill that you can just take and bingo, there you go. I will say resveratrol comes the closest, in terms of helping you deal with that. But yes, there is no known cure, but it will be, extremely beneficial for any individuals who are suffering from Alzheimer's to, yes, those lifestyle changes are by far more, dramatic in increasing the health of those individuals.
Well, Dr. Bredesen put these people on supplements too, and I don't remember for sure, so I can't say, oh yes, but I'll bet you lunch next time I'm out in California that he had them on resveratrol as well as other supplements that are known to mitigate the inflammatory effects of the brain and all these other things. Because I actually wrote a blog about it. I wrote a blog that said the cure for Alzheimer's may actually be the cure for aging. Because what he did was basically systems biology. He looked at these people and he said, okay, we're going to correct everything that's wrong with you right now. And let's see what happens to the Alzheimer's symptoms. And sure enough, they reversed. 26 people. Only 2 people dropped out of your trial, and he's about, I believe last time he was on the show last year, he was getting funding to do a larger scale trial. So it's very remarkable stuff out there that you're not going to see during the commercial breaks of watching Dancing with the Stars. Take this pill and you're all better. But rest assured, if you do the right things for your body will do the right things for you. Dr. Valenzuela, I know that you're very busy with your schedule. Thanks so much for being on the air today.
Thank you very much for inviting me.
Take care. So there you have it. And if you want to know about the best resveratrol in the world, go to superhumanradio.com. Look for the metacurcumin banner ad. That'll bring you to RevGenetics website. And they have some amazing products. I personally use the metacurcumin with the resveratrol. That's just me. But if you can only afford one, get the resveratrol, please. Only afford one, get the resveratrol, please. Only afford one, get the resveratrol, please. Only afford